We were having a conversation with Yakima County Commissioner Amanda McKinney. Looking forward to her 4 to 4:15, 15 precious minutes of FaceTime with Governor Inslee, to which she invited herself, which is fabulous. And she said she's going to check back in, and she's checking back in. Good morning, Madam Commissioner.
Well, good morning. How are you two gentlemen this morning?
Very well. We're good. Thanks for coming back. So, how was it?
Well, I will tell you, I honestly thought that it was going to be about 15 minutes of not having much substance. I figured that he wouldn't want to have, much by way of direct questions or answers.
Yeah.
But I will tell you, he went straight for it, and he wanted to know from me what I was going to do as elected leader to help him open the state by increasing vaccine saturation. And I said, all right, well, what you can do is drop the emergency order and end all mandates, because I would tell you right now that we've done a beautiful job of getting the vaccine readily available to everybody who wants it. And that's what we were driving for. But at this point, you're going to hold getting a vaccine over someone for getting their freedoms and liberties back that we all experienced and had before COVID. That's not going to work. People right now want to make a decision because they have free will and want to discern. They want to educate. Right. There may possibly be more people, who decide down the road to go get the vaccine, but we can't tie freedom to it. It's just something that doesn't work in our state or our country. And I do feel that if the barrier, or if we're holding it, I said, you got to use, this is a carrot. You may think creating segregated society is something that, is going to convince people to do something, but that isn't. It is a carrot. It's not a carrot, it's a stick. Because what we're doing is saying, if you want to do this, you must do this. And you know what? There are a lot of people who aren't going to do something simply because of the stigma attached to it that you've created. So let it ride. Let people make a decision for themselves.
Great
This
answer.
is something that's incredibly important to all of us, very personal. And that's when he shot right at me. Did you get the vaccine? Are you going to vaccinate your children? And that, wow. He was there to spar. There was no doubt about it. And so I shot right back at him. And I said, you know what? This is exactly the stigma that I'm talking about. This is a personal decision between me and my doctor. And when it comes to my children, I'm going to do a lot of discerning. And I said, I absolutely have gone on record supporting every single person who goes and gets the vaccine. You want it, you got it. That guy fought hard to get it here for you. But I fully support every individual who has not yet. Whether they do or not, it's
right.
up to them. And, I will tell you that he did not want to hear what I was telling him. And he told me my opinion was in the minority, and that the majority of people do want to get the vaccine. And I said, amen. You might represent 52%, sir, but I'm telling you what the other 48% are thinking because you asked me. So if you really want to hear how to change your messaging, I just told you. So I will tell you, he is completely out of touch, completely out of touch. And I say that with all sincerity because his staff of folks were sitting there, and I told him that there is shaming in the public for people who are choosing to take some time to think about this. And we can't have that. We have to remove that. We can't go there. And he said, there's no shaming. There's no shaming out there. Who's shaming? And I said, sir, with all due respect, with your press conferences, with your wording, with media, with mass media, I said, you can't go on social media right now without seeing an incredibly toxic environment. Both ways, I will add.
Right.
We have to remove the ability for people to think that it's okay to tell someone that they're crazy for getting it or not getting it. It's such an intensely personal choice. So take the stigma out of the room. And he absolutely denied that was something that was going on. And I said, well, I don't know what else to tell you. If you don't want to hear what I'm telling you, then nothing's going to change. Nothing's going to change. And I told him I wasn't going to directly recommend anyone do anything. And that was the fact. I said, I will recommend every single person do their homework, talk to your doctor, educate yourself. At the end of the day, it's an intensely personal decision, and in no way can we have our freedoms tied to it.
Good for you, Amanda. Good for you. I can't think of a better response. I am blown away. Well played, ma'am. Well played.
Yeah.
You are so absolutely right. He is out of touch and has been, ever since he took a big, long drink of the Green Deal water, and that has become his thing. I mean, he's just locked in on how he sees it. So to think that there's not shaming is a shame, quite frankly, because it does put him out of touch with so many.
And I acknowledged what it's clear to me I watch all of his press conferences. I have for now over a year. I complimented him on keeping the death rate low. I said, listen, I understand. It's clear to me that you are driving to have the lowest death rate, but that is commendable. I understand that to the point where we had the ability to offer the vaccine to those people who were most vulnerable. And he said, if I don't continue to lock the state down, we're going to continue to have people die. And we could have more than 17,000 additional people have passed away from COVID if I didn't lock the state down. And I said, quantify that for me. And he said, what do you mean? Yeah. I said, how are you arriving at that statement? Quantify it for me. And he simply said, well, there are other states that opened up and they had more people pass away. And I said, unless you can prove to me that you have stats and data to back that up, right now you're just making an assertion. But I'm going to give you that for right now and say that even if that was true and we were still getting to the point where we are today, which is that 70% of the population in the state of Washington over the age of 60 are fully vaccinated, which means there's still 30% of the population who has not opted to get the vaccine. They've had it available for several months. You can't save people from something they don't want to be saved from. And that's when he said his role as governor and the role of the state is to save lives. And I said, no, your role is to offer the people the opportunity to choose how to go on with life or save their life from this perceived threat. And if we applied that same logic to everything, we wouldn't have cigarettes. Our legislature wouldn't be legalizing hardcore drugs. We wouldn't see Doritos all over the place and Monsters. I mean, you name it. It isn't the government's role to tell you how they think you should live your life. And it's mind-boggling to me that there's some kind of a new idea and thought out there.
There is a quote from him in today's Yakima Herald Republic where he's talking with the nurses, and he says, "My job is to make sure you'll be bored to tears in the next year with no COVID patients." I didn't elect. I didn't vote, so I guess I can't say I didn't elect. We as a state didn't elect Jay Inslee to personally eradicate every case of COVID. If he can do that, then let's go to work on the flu. And hey, cancer's waiting out there too. Get on it. That is not his job. But I think that's very telling that he sees that he's got to be some sort of, I'm going to save you whether you like it or not. Okay.
That is right. There's critics out there who are upset at me, and I get it. They're afraid of COVID, and I don't judge anyone for being fearful of COVID. Not at all. I understand we have vulnerable people in our family too, and we wanted to protect them. And that's a natural human instinct to care about yourself, self-preservation, and to care about others. But just because I am an elected leadership role, I'm not here to determine what's best for you. And I'll never forget, I actually had someone very early on when I was elected, and I was working on some changes at the health board that they weren't pleased with. And they said that they absolutely only public health experts should be making decisions like this. I don't want you fighting for my right to choose. I shouldn't have a right. I shouldn't have a say. And that to me is just, we need civics. No, my job as an elected leader is not to make decisions for you that impact your body like that. There are certain rules and goalposts that the government is supposed to do, but we can't control every minute of every day of how someone lives. And right now we're living our lives according to those who are most risk adverse, and that's not acceptable.
Yeah, lowest common denominator makes the call, and you're right. That's not life in America as we know it, and we're seeing that play out not just here on this topic, but starting to spread out all across the country from Washington D.C. So. I'm delighted that you were able to take the stand. I know that the mayor was allegedly going to be in there with you. Did she join you? And did she?
Yes, she did. Yes. Well, I think I had reached out. I sent him an email and said, I understand that you're coming to Yakima, and you must have lost my invitation. And they, I think I mentioned they got back to me and said, all right, we'll give you 15 minutes. I will say I got 20. He didn't want to let it go. He actually had his staff tell him twice, tried to cut him off and say, you need to go. But I will say this. I wish that media had been in the room. I think it's unfortunate that he's not willing to have a conversation, a very real difficult conversation, because when he has his press conferences, those are softball pitches, and those aren't answers.
He doesn't want to be challenged. You challenged him, and he didn't want anything to do with it. So clearly, he doesn't want to face any kind of challenging questions. So
well, I tell you what, my husband, when I walked out the door yesterday, he said he has no idea what he's in store for.
Yeah, that's right.
Well, again, great job. He needs to hear that. He needs to know that that's out there. Not everybody is a sycophant and just telling him what he wants to hear and kissing his butt, like they probably are on the West Side. It's a real world out there, and there are people that see things differently, and they deserve to be heard. And it sounds like you deliver the message loud and clear. Good on you.
Well, with respect, too, I will say, there are people out there who, truly, if you think about it, we only have 36% of the adult population has initiated the vaccine in the state of Washington. When you add in the 16 plus, I think we're at 48%. And those are great numbers. And again, I cannot express this enough. I support everyone's decision to do what's best for them. And I think that's what's kind of different on the other side, is that you either have to do it our way or you're a terrible, horrible human being. Yeah. And I don't see a lot of people who are choosing to take their time about this thing telling other people, well, you're a terrible person because you want to. No, it's your choice. We support the right to choose. That's the whole point. And it isn't because you're a reckless human being. There are certain things we do every day. And I look at our poor children, which we've got another health board meeting tonight, and I will tell you, especially after my conversation last night, seeing how everybody else is opening up. I think Idaho just fully opened yesterday as well. I am going to be proposing that we just end locally our mask mandates, period. I got to get other people on board with me, so we'll see what happens. But, we have to dismantle this here.
Yeah.
And I will tell you this, Mayor Byers asked him, what is your plan? What is your plan forward? And I will say, she said everything Commissioner McKinney is saying about what is happening on there as far as the negative stigma, she's right, and she said, but I want to hear from you what your plan forward is for phase 4. And he said, we already have a path, he said. The path forward is we keep doing what we've been doing. We keep social distancing, we keep masking, we keep doing the things that we know are going to protect people until more people get vaccinated. And I cut him off and said, with all due respect, sir, that's not a plan. There was nothing in there that spoke of specificity. You were not concise. I didn't hear anything about what our actual plan out of this is. And he didn't, well, I just told you. So, he's vague on, he doesn't have details. But I will tell you that looking around at the room of people that he brought with him, they aren't being honest. They aren't allowing him to actually see what people are saying, and he is living in a vacuum right now. That's for sure.
Oh, how sad. Well, you keep fighting for us, and man, it sounds like you have been doing that, and thank you very much. And fight for that mask mandate to be lifted. That'd be wonderful as well. Keep in touch with us. Let us know what the outcome
Absolutely.
is of that meetings. Yes,
well, if anybody wants to watch, the health board has their meetings every 2 weeks now, and they are on Zoom. And the link for the health board meeting is on the Yakima Health District website. And it's always interesting because I'm always trying to bring up motions because I tell you what, the health board sets the policy for the staff to administer.
Yep.
That's how it works.
Yep.